Good morning. Today we are announcing the findings of an examination of Passport Health Plan, the nonprofit corporation which provides Medicaid services in the Louisville region. Passport holds the state's largest contract at $793 million for the current year. Our exam, which we are releasing this morning, calls for more accountability and transparency in the management and oversight of the Medicaid managed care provider. University Healthcare, or UHC, which does business as Passport, was created for the purpose of offering Medicaid services to beneficiaries in 16 counties. It was formed at the request of the state, and it is a partnership of the region's major medical providers that came together in 1997. Passport plays a critical role by providing medical services to 164,000 poor and disabled Kentuckians. The organization derives all of its funding from state and federal sources. UHC contracts with AmeriHealth Mercy Health Plan to administer day-to-day operations. Passport has been ranked among the best Medicaid plans in the nation based on access to care, overall member satisfaction, prevention services, and treatment. This exam by the Auditor's Office did not address the quality or delivery of medical services that are reflected in that national ranking. In March, the Auditor's Office announced its plans to examine issues concerning certain financial activity of Passport and of University Medical Center, or UMC, related to their affiliations with the University of Louisville and the Commonwealth of Kentucky. Auditors examined questions related to University Medical Center in a separate review from this report, where we made 5 findings and offered recommendations pertaining to policies, procedures, and transparency. That review of the University Medical Center is in the form of a letter with a response that is also in the form of a letter, and it's also available today if anyone's interested in seeing that, in addition to this Passport report. Our review of Passport began because our office received information from several sources that raised questions about the organization's governance, accountability, and transparency. The Passport exam makes 20 findings and offers numerous recommendations to both Passport and the state to help provide consistent, good stewardship of Medicaid funds. The exam recommends Passport's policies regarding expenditures and cash distributions should be consistent with the original goal of controlling cost in the Medicaid program. Auditors found that Passport's success has allowed it to accumulate substantial reserves. The exam found that Passport exceeded its state-required cash reserves for each of the 3 years reviewed. At the end of 2009, Passport had almost $77 million of excess reserves, over the amount that insurance regulators require, and that's after a distribution of $30 million. Passport distributed more than $10 million in 2008 as a return of capital to its original investors. Additionally, the program distributed indigent care grants of $10 million in both 2008 and again in 2009 to its original investors. The exam calls into question whether those $30 million in distributions are in compliance with Kentucky law and the IRS tax code related to nonprofits, and whether they were properly communicated to the Department of Medicaid Services. The exam recommends that Passport seek an opinion from the Office of the Attorney General and the IRS on those distributions. Auditors found that as Passport's excess revenues grew, it increased spending on lobbying, public relations, travel, and salaries, and provided financial benefits that favored its original investors over other area providers. Auditors found Passport spent nearly $14 million on consulting and outsourced services, including $1 million for lobbying and public relations. In response to allegations received during the exam, auditors found that UHC, or Passport staff, traveled frequently, stayed in luxury resorts, used limousine services, ate expensive meals, and purchased numerous gifts, all with funding received from Medicaid, and many without a clear business purpose. Auditors documented many areas where executives spent funds that do not appear to further Passport's mission. Auditors found that staff travel costs, primarily for 2 UHC executives, for the 3 years reviewed totaled almost $230,000. Auditors found almost $73,000 spent on meals. Auditors found several expenses for a 10-year anniversary celebration of Passport, including $242,000 for anniversary bonuses for employees of AmeriHealth Mercy, the third-party administrator. Auditors also questioned the benefit to Passport of $423,000 it contributed in local sponsorships and $250,000 it spent on memberships to various organizations. The exam recommends that the board strengthen all of its policies and oversight regarding spending. Auditors also found that 2 UHC executives received significant annual salaries and bonuses. The executive vice president's average annual income for the 3 years from salary and bonuses was $285,000, and that came from both UHC and the University of Louisville. In addition, she received compensation as a partner in a consulting firm that received more than $354,000 from AmeriHealth Mercy for consulting services. The exam found that the associate vice president's initial base salary increased by almost 33% from 2007 to 2009. In the area of governance, the exam notes weak ethical policies, numerous conflicts of interest, and calls into question Passport's board structure and oversight. Auditors found that the governing board of Passport is incorrectly structured based on federal guidelines and recommends restructuring the board to ensure equitable regional representation by all providers and significant beneficiaries. The exam notes that UHC executives have conflicts of interest that include a senior executive holding a consulting contract with a primary vendor that I mentioned previously under compensation, Passport employment arrangements and board representation that favor the University of Louisville, numerous donations and grant awards by Passport that were made to organizations with ties to the staff and board members, and UHC executives accepted gifts from Passport vendors. One of the critical questions going into this process and a point of public debate during the past session of the General Assembly last spring was whether Passport, as a Medicaid managed care program, saves the state money. Our audit points out that the program does meet the federal requirements of being budget neutral, but budget neutrality is a ceiling beyond which Passport cannot spend. To gain a true analysis, it will determine whether there are actual savings to the Commonwealth. We recommend in the audit a detailed study that compares cost in every category and evaluates what it would cost the state under a fee-for-service model to perform the same functions in that region. The Cabinet has agreed in their response that they will contract for such an analysis. The exam also makes recommendations to the Kentucky Department of Medicaid Services to strengthen contract negotiations with Passport. Specifically, the department needs to analyze more detailed financial information, including the levels of reserves, and evaluate cost comparisons before the final contract rate is negotiated. Passport plays such a vital role in the lives of many Kentuckians, it is imperative that it use state and federal Medicaid funds in an equitable, appropriate, and transparent manner. Any cost savings generated by the program should take the form of lower costs to the state or additional services. Our report does not express an opinion on the viability of managed care models for the delivery of Medicaid services. In fact, a managed care approach can prove to be an effective method for controlling growth in Medicaid costs. But if the state is going to continue to use this model or consider additional managed care approaches, it's critical that there is strong accountability and oversight of these public funds. Both UHC, doing business as Passport, and the Department for Medicaid Services have responded to the audit, and their responses are included in the final report. Passport officials, in their response, indicate their willingness to consider the audit's recommendations, and in their response, state officials at the Department of Medicaid Services commit to strengthen oversight and contract negotiations as recommended in the audit. In closing, I want to thank the team who worked on this exam. They include Brian Likens, over here to my left, the Director of Special Audits, Jill LeMaster, David Keynes, Liz Lau, Becky Walsh, Rex Hunt, and Larry McCarthy, a longtime Medicaid official for Kentucky. We'll be glad to take questions now, but I would also note that because of the complexity of the report, if any reporters want to stay afterward and sit down with us, with the audit team, to discuss the audit in any more detail or have any clarification or questions discussed, we'll be glad to do that as well. Thank you very much, and we'll take questions now.